Hi, this is Dr. Charles Krieger. I'd like to talk to you about ear infections. Well, what we specifically refer to as something called otitis media, which is the most common form of ear infection that we see in little kids and toddlers and small children. Did you know that this problem is within the top 3 reasons for antibiotics to be prescribed in America? That's right, ear infections in kids, if they're not the #1 cause of antibiotic prescriptions to be written, they're in the top 3. Now you think about that. That's a lot of antibiotics for a problem that actually is not helped by antibiotics. That's right, ear infections do not respond well to antibiotic therapy, nor do they respond all that great to tube surgery. See, the idea behind an ear infection, what happens is that the eustachian tube, which is the tube that goes from the ear to the throat, in little kids, that tube can become bent, kind of bent in a hook shape, right? Instead of being straight, so that the fluid can drain down to the throat. When there's a spasm in the muscles of the neck, that tube becomes hook shaped, like my forefinger here. So fluid can pool in the crook of that hook shape, much like still water on a pond will attract mosquitoes. So now you have bacteria growing, and you hit that bacteria with antibiotics, and yeah, that infection will go away. But what has not changed? Well, that bent tube still isn't changed. So that fluid is still there. So the bacteria can still go, just like the mosquitoes can still go to that still pond until it gets drained. And you can hit that pond with lots of insecticide, but all you do is get strong mosquitoes. Same thing is true with your kids' ear infections. You can hit it with antibiotics over and over, and all you're doing is making strong bacteria. And incidentally, the other thing you're doing is wiping out your child's friendly flora, the friendly bacteria that are in your child's gut, that, as you probably now know, makes up a big hunk of your child's immune system. In chiropractic, what we have learned is that gentle, specific adjustments to the child's neck allow that tube to straighten out, because the muscle spasm gets relieved when we correct the child's cervical spine or his neck. Now, straight tube equals drained fluid equals no more ear infections. We know from research that's been done that chiropractic adjustments work better on ear infections than either antibiotics or tubes or both put together. And we do it safely and pretty quickly. If you're interested in learning more, please call our office at 770-993-4425, or you can go to our website, KriegerHealthSolutions.com. We look forward to hearing from you soon.